Well, Rohan, good to see you again.
Likewise. It's been a year.
It has been a year.
So yeah, nice to be back.
Excellent. How would you say the industry has changed in the last 12 months?
Well, it's interesting. I mean, we've seen a lot more emphasis on in vivo CAR T for sure. We've seen a lot of acquisitions in the in vivo CAR T space.
Definitely.
Major pharma buying that up, but at the same time downsizing in other areas where let's say pipeline products that are not showing true efficacy or not advancing to phase 3 are sort of being sunsetted, which I think is an indication of the industry's appetite for just quick and efficacious results, right?
Right.
So we're seeing a lot more of that, and as a result, things are changing, right? For the better, I would say. We're seeing more people adopting that idea that maybe we don't need logistics for all of the temperature ranges that we're thinking of. Maybe we need to start future-proofing for minus 80 or lipid nanoparticles and things like that.
Right.
And just generally speaking, I think the products that are really doing really well are autologous CAR T is here to stay, as we know. That's not changed since last year. A little bit more, I think, sort of light at the end of the tunnel on the allogeneic space. So yeah,
Gotcha.
Looking positive.
Yeah. So in the context of those changes, how is Marken adapting the way that it looks at these different therapies?
Well, I think understanding the science behind them, I think, has helped a lot. So, we have increased our footprint of our team. We have 120 people on the team, dedicated to advanced therapy. But we also have the biology understanding of maybe right now we should be focusing a lot more on autologous CAR T therapy, but in 10 years, perhaps we should be focusing on in vivo, right?
Right.
And so how do we, adjust our infrastructure, our footprint? Where do we need to be placed to support the existing kind of autologous landscape? Do we need to be looking at larger quantities of therapies shipped into key regions as allogeneic therapy takes off? We're seeing some, therapies in phase 3 and possibly going to commercial in that space. And with just the momentum in the field, I think understanding that things are only going to get more complex.
Right.
Supply chains are going to be more disrupted as time goes on. So
makes sense. So yeah, in the context of an increasingly crowded logistics market, from your perspective, how do you maintain your position as an industry leader as opposed to a generic service provider in this area?
Yeah, and that's a really good question, because there are others out there that do this, right? The question is, do they understand, what they're doing, and are they adapting, right? I think that was your earlier question as well. We understand from the field and our customers that their pain points are things like, driver showed up, but they were wearing the wrong type of outfit, or they didn't, the optics of that weren't good, they showed up in the wrong type of vehicle. We try to actively avoid those things by having driver excellence. We have a control tower that monitors the shipment from A to B, all the way 24/7, right? So we have mechanisms in place and controls in place to avoid that. And like you said, it is a bit of a saturated market, but what differentiates us is our knowledge of the biology, our understanding that things are going to change. We can't be stagnant in our ways. We can't do things the way they were done 10 years ago when CAR T first came out. Things are constantly evolving. One day, maybe it's not going to be a liquid nitrogen shipper. And also understanding that, patients and clinicians and manufacturers are demanding lower costs, but equal kind of, quality. And so those things are typically at odds with each other, but we can optimize that solution by leveraging some of our, UPS backbone to say, maybe we can use our own airline. Maybe we can use more, a hub and spoke model as opposed to kind of centralized sort of manufacturing, and supporting the industry better through our connections and our relationships with airline carriers and regulatory agencies and things of that nature.
Gotcha. I remember one thing we talked a little bit about last year was just this idea that with Amazon or with a Domino's pizza, right? You've got a tracker and you can see it from when the pizza's being made in the oven till when it gets to your door.
That's right.
How are you guys taking that approach to delivering something similar for your clients?
Well, every advanced therapy shipment has a GPS tracker on it for us, right? That's just it's not even a thing where we say, would you like to pay for this? It's more like you have to opt out if you don't want that on there, because for us, it has to be trackable, it has to be traceable, and the technology plays a big part in that, but it's not the only solution, right? So we have a GPS tracker on every advanced therapy shipment, but we also have a team that's looking at that GPS trace, making sure that it's not going the other direction. We've had instances where our control tower has said, wait a second, that shipment's going the wrong direction, right? It's supposed to go on Highway 90 and it's going on Highway 270 or whatever. So we've actually stopped that in its tracks, interceded, and actually been able to save the day because of that. But it's also temperature. Like if we see a trend towards, let's say, a deviation in a temperature trace, we can do something about that too. And like you said, if we can get this on our Amazon package or our Domino's pizza, we should be able to do it on a $4.2 million gene therapy, $3.1 million gene therapy. But as the field evolves, perhaps we can look at those as edge case scenarios more than things that we need on every shipment. And when we get to a point where we're more mature and we can say we trust the logistics, we trust the supply chain, we trust UPS Healthcare because they've been around for hundreds of years, right, in the space. They're going to be able to do this without the need for that technology solution, and maybe more automation and AI can take over in that sense.
In your view, what would be the key components that would define a gold standard for logistics when it comes to advanced therapies?
So for me, it's when you look at how the field is moving, I think of it as like, what would happen, just to rephrase your question, what would happen if we had a first-line therapy approval, right? It's basically the question of how do you scale, right?
Yeah.
Right now we're, I guess, in some ways unfortunate because it's not a first-line therapy, and therefore cancer patients are not receiving these therapies first. They go through 2 or 3 prior lines, and then when they fail those, they get to, a CAR T therapy, for example.
Right.
But if they were to, and we've already seen second-line approval, so at this point, first line is just on the horizon. If that happened, are we ready, I guess is the question, right? And in my mind, so that kind of answers the question of what is the gold standard. We need to be able to adapt to potentially 1 million CAR T patients a year and not just 10,000 or 20,000 as we're currently doing. To date, there have only been 40 to 50,000 CAR T patients dosed in total. And that's for over 15 years of doing CAR T therapy. So you can just imagine if it becomes first line, we're going to have a pretty big problem on our hands from a supply chain perspective, whether it's the media, the raw materials, the logistics, the supply chain, the manufacturing, all of that stuff is going to have to really, basically it's going to be a common problem for all of us to solve and not to be separate in our ways. So we have to put our heads together and come up with a solution that allows us to treat that many more patients and that much quicker and be more agile with it and more efficient from a cost perspective, because ultimately the cost of goods cannot increase when that happens.
Sounds good. All right, that's just about the end of my questions.
All right.
Thank you so much for coming on.
Always a pleasure, Ben. Yeah.
All right, are we going to play a game?
Well, let's do a game. Let's do it. I'm going to try first, and you tell me. You go next. Oh,
You can come and get one of these from the Marken booth.
it's a cornhole board. Please have a go at it, and you get some ice cream and a cornhole board for free. So
Sweet.
oh, you got one in.
Hey!
Oh.
Oh, all right.